I'm Dr. Gwendale.
As a doctor of psychology and professor at San Diego State University for 25 years, Dr. Gwendale has a unique life experience.
What do you think is the secret to a long life?
My personal opinion? Are you asking me because of my age?
Maybe you're successful aging.
Yeah, well, I'll be 96 in 4 months, and I think I'm still uh, there.
She credits a Mediterranean diet, staying active, and a positive outlook, even after a health issue required her to hire in home care 8 years ago.
They wouldn't let me out of the hospital after the surgery I had unless I had someone at home to take care of me. And that's where it all began.
From a client's perspective, what's most important in receiving quality in home care?
I think the caregivers need to be competent, compassionate, and caring. I call it the 3 C's of a good caregiver. And we're all human beings, so are caregivers. But the major difference between the caregiver and the client is the client is going through all kinds of things unpreventable by the caregiver. But a caregiver that has the compassion and the caring, as well as the competence, is to me the highlight of a good caregiver.
Mm-hmm.
And as a human being, she's going to have life situations and all those things. But as a caregiver, it's like anybody in the medical profession. You kind of need to put those things aside when you're in charge of a patient or a client. And so when they come in the door, they need to leave those outside the door. And it's wonderful when they can be there for the patient, not um, running their lives or anything, but being present and being emotionally present in a positive way without their own problems interfering.
What are some caregiver behaviors that a client wouldn't like?
I understood that caregivers were not to be on their cell phones. If they're on their cell phones all the time, they're not present for the person they're to serve. And it's actually rude. And most caregivers, I think, are really good about that. But there are a few instances where they're addicted to their cell phone and they don't realize that what they're there for is the client, not their personal wants, needs, or whatever.
She believes every person is mind, body, and spirit, and quality caregiving addresses all three.
Because you don't know what your client has been experiencing, and this is the client's home. They can't go anywhere else to be who they are, how they are, and in their recovery. And a compassionate, caring caregiver can be such an advantage.
She's happy to share her thoughts, just as her parents shared their life lessons with her.
My father taught me there are 3 sides to every story: your side, my side, the other guy's side, and the right side. And my mother taught me that what you do when you think no one is looking is a measure of your character.
Great lessons.